Over the past several decades, Kenya has become an economic and innovation hub in East Africa, growing from all sectors including healthcare. Kenya's healthcare sector is one of the most dynamic in Eastern Africa. Of importance to note is that rising income and population over the last decade have fueled rapid growth in the health sector, particularly among for-profit providers.
Poor health consumers are actually paying more than those who are insured or had higher incomes. Why? Because they had poor quality of delivery. They'd end up going repeatedly to get the same problem treated. We discovered a phenomenon called the poverty penalty. Because the problem wouldn't get solved, they'd pay again and again, they'd lose work and end up actually spending more.
The desire to improve operation of public health services and facilities and to expand access to higher quality services are among the key factors driving governments worldwide to use the public-private partnership model, whose results include more potential partners for governments as private healthcare sector matures and a significant percentage of the poor seeking affordable quality healthcare at for-profit health services.
The private sector, development partners, public sector, counties, faith-based organizations, we should form a strong partnership, and it's only then we will achieve universal health coverage in Kenya.
Over the last 10 years, interest and experience in leveraging the private sector to achieve national health goals has grown. In response, DFID designed the Private Sector Innovation Program for Health, PSP4H, to carry out action research into how a market systems approach might benefit pro-poor health interventions in Kenya.
The Private Sector Innovation Program for Health, PSP4H, was conceptualized by DFID in 2013 as a 2-year action research project to get proof of concept on if the M4P, or making markets work for the poor approach, would work in the health sector.
So the objective is to foster sustainable healthcare business models that result in a win-win scenario, whereby that clinic will be making profits and we're also increasing access and affordable healthcare for the poor.
PSP4H supported the private sector to invest in providing healthcare products and services to the poor by conducting market research, assisting them put together strategies, business plans, and helping them market products and increase bargaining power in the market by doing it collectively.
Our research informed us that if we target the private sector, the poor can actually access quality, affordable healthcare.
As a first initiative, PSP4H had to map out 273 donor health programs in Kenya in March of 2014 and identified 7 underserved areas within the Kenyan health market where market systems development programming would work best. They were
non-communicable diseases, supply chain, diagnostics, low-cost delivery models, healthcare finance, e-health and m-health, and maternal health.
Through PSP4H, Cardno employed the principles of the Making Markets Work for the Poor, which seeks to sustainably reduce poverty by identifying and addressing where markets work inefficiently for the poor.
Some of the key innovations we came up with were networks. We found that it was easier to bring these people together, running their own business as theirs, and enlightening them on what they're supposed to do. Taught them on business skills training, which was lacking, and we directed traffic towards their business. And by doing that, we eliminated a lot of quacks. And you found that the working poor, the low-income earners, at the end of the day, got information on where to get the right drugs.
PSP4H partnered with the Kenya Pharmaceutical Association, KPA, to develop the FarmNet network of affordable quality-assured pharmacies with 323 outlets in 7 Kenyan counties as of late 2015. FarmNet outlets are owned and operated by independent KPA members.
Our medications and everything and all the services, they are of good quality.
PSP4H has been an innovation center for private health sector investors with innovative ideas. The objective is to foster sustainable healthcare business models that are win-to-win and profitable for business while delivering better value to the working poor.
Yoguka kurutwo kirio muthi bandage ndakiheo dawa sitea ni thibitari njega iratuthondeka na nitukenete tondu turari gutuika itumumu.
PSP4H has acted as a healthcare consultancy firm to private healthcare partners, supporting partners in investing in activities that will enable them to better serve the poor.
We've known PSP4H for the last 3 to 4 years. They came in, helped us market. We had few billboards put across the city. We had many people calling to make inquiries about our services. Right now as we speak, we've grown to an average of around 55 patients. That's in a span of 2.5 years.
PSP4H also assisted partners establish networks of private facilities where they are able to enjoy the benefits of co-learning, jointly accessing training and other opportunities, and having increased bargaining power in the market.
Initially we used to see 5 to 10 patients. That's before the LabNet issue. But now, currently, our numbers ranges from 15 to 20 per day. We have actually managed to win most of the people confidence.
The business models were cash flow management, inventory management, and customer care. And you realize customer care is a big issue in health service delivery.
Eunice gave birth here, and she gave birth in twins, both female, alive, and she gave birth SVD, whereby there is no any operation which was done.
In capacity building of the members, we have taken much of the load which was on the public hospitals. The rate of maternal and neonatal death has reduced significantly.
We have also assisted partners to establish private healthcare clinic networks where they've been able to enjoy the benefits of co-learning from each other, branding, accessing business skills training and other opportunities, and they also have the value of a larger bargaining power.
PSP4H also partnered with other stakeholders to establish asthma model clinics in Nairobi.
TOTs would support the e-learners, maybe through the practical sessions, the proper use of an inhaler, an nebulizer, and even coming up with innovations for nebulizers in case a facility does not have.
The mandate of the Asthma Care Improvement Project, ACIP, is to develop and implement a sustainable asthma initiative targeting low-income populations in Kenya. The project aims to build on existing asthma care partnerships in the public and private health sector, subsequently leading to the reduction of the burden of asthma care and management in Kenya.
PSP4H as a development program is a model for the development world in that it showed value for money, it showed adaptive management, it showed private sector investment, it showed leverage of the donor's investment, it showed payment by results, and overall it came up with some sustainable business models that can be used in the future to bring for-profit healthcare to the mass market in the developing world.